Let's talk about the brain stem. When you look at the way the brain develops, the brain has got the forebrain, the midbrain, and the hindbrain. The forebrain has got two parts, the telencephalon, which is basically the cerebrum, and the thalamencephalon, which is also known as diencephalon. Now, the diencephalon is made up of parts like the thalamus, the hypothalamus, the epithalamus, the subthalamus. The midbrain, this is now a connection between the forebrain and the hindbrain. And we'll talk about the past that actually it is a part itself as a midbrain like that. The hindbrain has got the pons, the cerebellum, and the medulla oblongata. So the way the brain develops is that the forebrain will come from what is known as, you first have the developing neural tube, and this neural tube will start dilating for the brain. For the spinal cord, it just remains like that. So the forebrain comes from the prosencephalon, which will give you the thalamus, the telencephalon and thalamencephalon. Telencephalon is the cerebrum, thalamencephalon is the diencephalon, which makes up parts like the thalamus, hypothalamus, the epithalamus, subthalamus. The midbrain comes from the mesencephalon, and this one just gives you the midbrain. So we call this as the primary vesicles. The primary vesicles is the prosencephalon, mesencephalon, rhombocephalon. And then we have got the secondary vesicles. The prosencephalon, you can see there are two, telencephalon and thalamencephalon or diencephalon. And then for the mesencephalon, it still remains as the mesencephalon. The rhombocephalon will form the metencephalon and malencephalon. The metencephalon gives you the pons and the cerebellum, and the malencephalon will give you the medulla oblongata. So that is how this develops. And when you look at the brainstem is basically the structure connecting the spinal cord to the cerebrum. Okay. So when you look at these parts of the brainstem has got the midbrain, the pons, and the medulla oblongata. And these three parts are connected to the cerebellum. So the midbrain, which is the topmost, is connected to the cerebellum via the superior cerebellar peduncle, and then the pons, which is on the middle, is connected to the cerebellum via the middle cerebellar peduncle. The medulla oblongata, which is down, is connected to the cerebellum via the inferior cerebellar peduncle. What are the function of the brainstem? You have got the pathways of tracts between the cerebral cortex and the spinal cord. The ascending tracts and the descending tracts will actually pass through the brainstem. It is also the site of nuclei of the cranial nerves. The third cranial nerve up to the 12th cranial nerve nuclei are actually found in the brainstem. And then also the site of emergency of cranial nerves. That's where cranial nerve number 3 up to cranial nerve number 12 will come from. And it also contains the nuclei and related fibers like the reticular formation just there in the brainstem. What is the function of the reticular formation? To control the level of consciousness. Are you conscious? Are you awake? And then perception of pain. How do you perceive pain? Are you feeling pain? Sometimes you can be hurt, but you can be injured, but you're not feeling pain. So that perception of pain is because of the reticular formation and regulation of cardiovascular and respiratory system. That's why if there is a death of the brainstem, there's going to be no control of the heart and the respiratory system. Basically, someone will end up dying. Okay, and it's also a it's a vehicle of sensory information. So all sensory information has to pass through the reticular formation. You can see this is what we call the reticular formation. These fibers just projecting, found in this brainstem, and you can see the different nuclei that are found in the brainstem. Okay, for example, I've got the Edinger Westphal nucleus on top. You have got the oculomotor nucleus, you have got the trochlear nucleus, and then as you get to come down, you have got the motor nucleus of the fifth cranial nerve, the abducens nucleus, the superior salivatory nucleus, and then the rest of them, which we would discuss them. Okay, you have got different projections of the cranial nerve nuclei. You can see the motor nucleus on the middle here, and then the mesencephalic nucleus also, which is the nucleus of cranial nerve number 5, also there. You have got the many sensory nucleus. You know that for cranial nerve number 5, it has got a lot of nuclei, the mesencephalic, the many sensory, okay, so and the different parts. But to understand this as we get to discuss them one by one. So let's first start looking at the external features of the brainstem. And you know, we've said the brainstem is made up of the midbrain, the pons, and the medulla. So we'll look at the external features of all these parts and then also look at the internal features. So starting with the medulla oblongata, the external features. When you look at the external features, you are going to get a brainstem. You look at it from the front and also from the back. So from the front, the medulla oblongata is this structure that is down here. So you can see you have got first elevations and depressions. So for the elevations, we have got these two elevations. We call these ones as the pyramids. You have got one on the left and one on the right. And then the other elevation, these are the ones that are behind, we call them the olives. So the main elevations on the anterior aspect of the medulla oblongata, you have got the pyramids and the olives. And then the depressions on the middle, separating the two pyramids, you have got the ventromedian sulcus or fissure. The ventro, which just means front, median fissure, okay, separating the two pyramids. And then separating the pyramid from the olive, you have got this fissure here. And what is the name? We call it the pre because it's in front of the olives. The pre-olivary, but now it's not deep, so it's not known as a fissure. It's known as a sulcus because it's not that deep. So I've got the pre-olivary sulcus, also known as the ventrolateral because it is in front but on the side. Ventrolateral fissure. And then there is also a fissure just behind the olives. We call it a post-olivary sulcus. Why am I mentioning fish? So it's sulcus. Post salivary or post olivary sulcus. It's also known as posterolateral because at the back on the side. Postlateral sulcus. Okay, so it's important for us to understand that. So when you look at the ventromedian fissure, this ventromedian fissure, this fissure separating the two pyramids, it divides the medulla into two halves, as we know, and its lower part is going to have a decussation. A decussation is basically where some tracks, there is crossing of the tracks. So there's going to be decussation of the pyramidal or the corticospinal fibers. It's important for you to understand. Remember when we are discussing the descending pathways, we have got the corticospine, we have got the pyramidal and the extrapyramidal uh, tracts. Specifically, the pyramidal ones, you have got the corticospinal and the corticobulbar. But the corticospinal, they move from the cortical area, the cerebral cortex, up to the spinal cord. They come and decussate, they come and change direction. So the fibers that we are moving from the left side of the cerebral cortex will now go to the right side and vice versa. And that happens on the pyramidal decussation. When you look at the pyramids themselves, these are an elevation on either side of the ventromedian fissure, and they are produced by the corticospinal tracts, which are descending motor tracts. Because remember, the descending tracts are actually motor. And then you have got olives, which are also elevations which lie lateral to the pyramids, and they are produced by inferior olivary nucleus. The inferior olivary nucleus controls movement. Okay. And then what are some of the nerves that come from the medulla oblongata? So you have got the hypoglossal, which is the 12th cranial nerve, and then you have, so basically you have got cranial nerve number 12, number 11, number 10, and number 9. That is how they move. 10, 12, 11, 10, and 9. Now, if you see the way these guys come out, cranial nerve number 12 comes out from the sulcus between the pyramid and the olives. Okay, you can see the pyramid and the olives, the sulcus between, which we call the pre-olivary sulcus. That is where cranial nerve number 12 comes from. And then now you are going to have the rest. For cranial nerve number 9, 10, and 11, these ones come from the dorsolateral sulcus, or the post olivary sulcus. And in that order, that's how they come from, away from. So you can see cranial nerve number 12 is alone in the pre-olivary sulcus. Now number 10, number 11, and number 12, it is in the post-olivary sulcus. And you can see cranial nerve number 9 is on top, and then cranial nerve number 10 is going to be down, and then cranial nerve number 11 is the one that is very, very much down. So please take note of where these ones come from. So though this is the ventral surface or the medulla oblongata. Now, when you look at the back of the medulla oblongata, that is the dorsal surface, it is divided into the closed medulla, which is caudal, and then the open, which is cranial. Cranial just means on top, caudal means down. So the top part of the medulla is actually closed when you are looking at it from the posterior aspect, while the caudal part, that is a down part, is the one that is closed. The upper part, which is cranial, is open, as you can see here. Okay, so from all the way from this part to the bottom here, this is the medulla. And then you can see on top, which is the cranial part, it is open, and then the one that is down, it is closed. So when you start with the closed part, which is down, there is a cavity which is known as a central canal. And the central canal, it continues with the spinal cord. As you can see there, the very middle there, that is central canal. And then the caudal part is composed of the dorsal median sulcus. Why are we calling it dorsal? Because this median sulcus is actually at the back. Remember, in front we also had the ventral median sulcus. Now, the dorsal median sulcus divides the closed medulla into two halves, and this is the one that you can see, dorsal median sulcus, also known as the posterior median sulcus, because posterior and dorsal is the same thing. And then on either side of the dorsal median sulcus, you have got the fasciculus gracilis, or gracile fasciculus. Okay, you can see on this part and also on this part, you have got the fasciculus gracilis. Okay, so this structure that you can see here and here. And then you also have the gracile tubercle. Now, fasciculus gracilis in so fasciculus gracilis is a structure, and then that is going to be seen externally as a tubercle. A tubercle is an elevation that is produced at the upper part of the fasciculus gracilis. Okay, so inside you have got the fascicles, you have got these fibers that are running. But when you look at it outside, you are going to see as a tubercle. So this is the tubercle, the gracile tubercle. And when you go a bit lateral to the gracile tubercle, you are going to see the cuneate tubercle. Okay, so I've got the fasciculus cuneatus, which is on either side of the fasciculus gracilis, and then the fasciculus cuneatus produces an elevation which we call the cuneate tubercle. Okay, so it's important to understand the cuneate tubercle is an elevation that marks the site of the cuneate nucleus, just like the gracile tubercle just tells us where the gracile nucleus is. So this tubercle, this is where the gracile nucleus is, even this one. But continuing down here, you are going to have the fibers which we call the gracile fasciculus, and then cuneus fasciculus. Hope we understand that. This tubercle is because of the nucleus. Continuing down, you have got fibers that just produces the fasciculus. Fasciculus gracilis is medial, and then cuneatus is lateral. Okay. The way you can remember is, remember the gracilis muscle on the thigh, it is more medial. So you remember that gracile nucleus or gracile fasciculus is more medial, just like the gracilis muscle is medial on the thigh, and then the cuneatus is going to be lateral. Okay, so that is it on the closed medulla, which is the caudal. This was supposed to be caudal, caudal. And then the cranial part is open, and the cavity that is found on the cranial part is the fourth ventricle. Okay, so we're going to have the fourth ventricle. That is a cavity that you find in the closed part. And then on either side, we have an inverted V-shaped sulcus, which divides the area into three parts. Okay, an inverted V-shaped structure. You can see there is this structure here. So it is going to divide the area into three parts. From medial to lateral, we've got the hypoglossal triangle, which overlies the hypoglossal nucleus, and then the vagal triangle, which overlies the vagal nucleus, and then the vestibular triangle, or the vestibular area that overlies the vestibular nucleus. Okay, so those are the three areas. So from medial to lateral, you start with the hypoglossal triangle, and then the vagal triangle, and then the vestibular triangle. So those are the main parts. Okay. So again, you can see the gracile tubercle, it contains the gracile nucleus. So that red dot there is the gracile nucleus. Okay. And then you have got the cuneate tubercle, which has got the cuneate nucleus. Take note, because you can just see those same dots, they'll give you a picture for you to be able to label. And then you have got the fasciculus cuneatus more lateral, and then you have got the fasciculus gracilis more medial, and then you have got the sulcus on the middle, the dorsal median sulcus. And then you can see the areas that we mentioned, the hypoglossal area, you can see the medialmost, and then you have got the vagal. This is the hypoglossal triangle. Then you have got the vagal triangle, which is a bit more down. Then you have got the vestibular area, which is even more lateral. So this is the open medulla. Okay. Again, this is just a structure again showing the same things we're from talking about. You can see the hypoglossal triangle, also known as hypoglossal trigon. This is the one on top, and then down here you have got the vagal triangle. If you come more on the lateral aspect, you are going to have the vestibular area. This is the one you can see. So that is it on the medulla oblongata, the external part, both in front and at the back. Please make sure you can be able to identify the parts. They can ask you the following parts make up the external part of the medulla, either anteriorly or posteriorly, and they can as well bring a diagram. After the medulla, we go to the pons. So the pons, this is the structure that you can see on top here. Okay, this structure here. So starting from the anterior aspect of the pons, first, the ventral surface, we are going to have the basilar sulcus, which will divide the pons into two halves. Okay, the basilar sulcus. This is the basilar groove. This medial part, it divides the pons into two parts which are equal on the left and also on the right. What is contained in the basilar sulcus is the basilar artery. Remember what forms the basilar artery? You have got the two vertebral arteries forming the basilar artery, so that you can be able to form the interior circle of, remember, it's from there that you are going to have the basilar artery giving you branches that to connect with the ones coming from the internal carotid, forming the circle of Willis. Okay. And then you have got the transverse pontine fibers, also known as the pontocerebellar fibers, coming from the pons to the cerebellum. So these ones originate from the pons in the pontine nuclei, and then will cross the midline and pass through the contralateral cerebellar peduncle to enter the opposite cerebellar hemisphere. So we're going to the opposite side. Okay, so those are the transverse pontine fibers. But then you cannot. So these are the fibers that you hope you can see, these ones which are running like this. They come from the pons on one side and then they go to the other side. Okay, you can see via the cerebellar peduncle. So that is it. Now, what are the nerves that originate from the pons? So from the pons, you have got cranial nerve number 5, number 6, number 7, and number 8. Remember, from 9 to 12, it is from the medulla. Okay, 5, 6, 7, 8. So 4 from the medulla, 4 from the pons. and then 2 will come from the midbrain, and then 2 from the cerebrum. Okay, that's how the cranial nerves comes out. So the trigeminal nerve, it comes from the middle of the ventrolateral aspect of the pons. So just this big one on the anterior aspect, but a bit on the lateral, this is the trigeminal nerve. It's also important for you to understand that when the trigeminal nerve is coming out, it has got two roots. You can see the smaller one and the big one. Okay, so it has got a large lateral sensory root and then a small medial motor root. So just remember medial motor, and then sensory is going to be the large one. Okay, so large lateral, that would be the sensory. So think of L. Large is lateral, and that's the sensory, and then medial is the motor, and that's small. Please take note of that. That's important. Medial is the motor, the large is sensory, and that's the lateral. Okay, that is the first one that is so prominent. The next cranial nerve is the cranial nerve number 6, abducens, and this one comes out from the junction between the pons and the pyramids. Now the pyramid is this elevation on the medulla. So this one here, this is the abducens cranial nerve number 6, sorry. And then as you get to go now on the lateral aspect, you are going to have now cranial nerve number 7. Again, cranial nerve number 7 has got two roots. It has got the motor and the sensory. Okay, that's the facial. And the facial nerve and the vestibulocochlear, cranial nerve number 7 and number 8, they come out from the cerebellopontine angle, or the cerebellopontine junction, the junction between the medulla, the pons, and the cerebellum. And these nerves, they both emerge as two roots. So both the cranial nerve number 7 and cranial nerve number 8 will emerge as two roots from the medial to the lateral. You start with cranial nerve number 7. So the only difference is that here the motor one is okay, it's the same. The motor here was the medial, right? For cranial nerve number 5. Same, the motor is medial for cranial nerve number 7, and then you have got the sensory. But the so you can see this is the motor and then the sensory. But the only difference is that for cranial nerve number 5, the motor was small. The sensory was bigger. Different for cranial nerve number 7, because the motor one is actually the one which is medial, but it's also big. Okay, so this is the motor and it's big. You can even see it here. This is the motor and it's big. This camera small one is going to be the sensory root for cranial nerve number 7. And then we are going to have now cranial nerve number 8. Cranial nerve number 8 is vestibulocochlear. So it has got the vestibular root and the cochlear root. So we're going to start with first with the vestibular, that one which is involved in balance, and then cochlear, the one that is involved in hearing. So that is vestibulocochlear. Okay. So sometimes you can have what we call schwannomas. These are tumors that can compress the cerebellopontine angle. So in that case, this is going to affect cranial nerve number 7 and cranial nerve number 8. So in a case of a schwannoma, because those guys are actually so close together, they are both found in the cerebellopontine angle. So that is the ventral aspect of the pons. So what you need to understand is the basilar sulcus, and then also the pontine pontocerebellar fibers, or the transverse pontine fibers, which will pass through the cerebellar peduncles, carrying fibers from the contralateral aspect of the pons going to the other side. But of course, you only see this middle cerebellar peduncles. The fibers themselves will not be able to see them as an external structure. And then also know the cranial nerves that originate from the pons, and where they originate from, and which specific uh, root. Is it the motor one? Is it the sensory? Where is it located? When you go now to the dorsal aspect, this is the dorsal aspect of the pons. You can see this part here. Okay, so the dorsal aspect separated from the open medulla by an imaginary line that is passing between the margins of the cerebellar peduncle, the margins. This imaginary line, okay, is actually going to be found on the margins of the cerebellar peduncle. Remember, the middle cerebellar peduncle connects the pons to the cerebellum, which is supposed to be behind here. Okay, so on either side of the median sulcus, so you also have the median sulcus in the pons. So this is the dorsomedian sulcus, the one which is continuing with the dorsomedian sulcus of the open medulla. So for this one, on either side of the median sulcus, you have got two structures from medial to lateral. You have got the medial eminence and the facial colliculus. Okay, these overlie the abducens nucleus. So the nucleus, abducens nucleus, so the nucleus of cranium nerve number 6 is inside the medial eminence and the facial colliculus. The medial eminence is much in front. Okay, so this is the one here, medial eminence, and then you have got the facial colliculus. You can see it's supposed to be a bit lateral. Okay, and you can see it's even much bigger. So that is it. And then you also have, so you have got the medial eminence and facial colliculus. These are actually continuous, they are all medial. All right, so it's just that the medial eminence is a bit of more on top, and then the facial colliculus is a bit of more down. And then now you have got the vestibular area, which overlies the vestibular nucleus. Okay, that's a vestibular area, and it is more lateral. Okay, it's the lateral aspect. So medially, just following the dorsomedian sulcus, you have got on top the medial eminence, and down you have got the facial colliculus, and then laterally you have got the vestibular area, which overlies the vestibular nucleus. And then, so the dorsal surface of the open medulla and pons lie in the caudal one third and rostral two-thirds of the floor or the fourth ventricle. So the dorsal surface of the open medulla and the pons. So in other words, the open medulla and the pons, these guys, this dorsal aspect will overlie. This is where we're going to find the fourth ventricle. But the the open medulla will only form one third of that covering, and then the pons will form two thirds because it's much bigger. Okay, you can see the pons will form a much bigger area that is covered in the fourth ventricle. So that is the external aspect of the pons. So you can see this is the fourth ventricle. Okay, medulla is just covering one third, and then the pons will cover the majority, which will be the two thirds. And then the midbrain. The midbrain, again, you look at the ventral aspect and the posterior aspect. Okay, so the midbrain is this structure that is on top here. It looks like a short. You can see this is like my leg. This is another leg. So that's the pons. So the ventral surface, you have got large columns of descending fibers on the ventral aspect, which we call, these are descending fibers, the crus cerebri, also known as the basis pedu, pedu, pedunculi. Okay, pedunculi, like the way we read peduncle, or depending with how you want to read it, pedunculi, but pedunculi. Okay, so remember that the crus cerebri is ventral and also known as a basis pedunculi, and is on either side separated by a depression known as the interpeduncular fossa. So we have got this depression here. That's what is known as the interpeduncular fossa. Okay, and in the just within the interpeduncular fossa, we have got what we call the posterior perforated substance. Okay, posterior perforated substance in the interpeduncular fossa, and then on the sides, that's where I've got the crus cerebri. I hope that makes sense there. And you can see, of course, connecting the midbrain to the cerebellum, you're going to have the cerebellar peduncle, the superior cerebellar peduncle. Okay, that is important to know. And then the nerves that are emanating from the ventral surface of the midbrain, you just have one, which is the oculomotor, from the middle aspect of the crus cerebri. You can see this one here. Okay, the crus cerebri is laterally, and then it's here. Okay, that is going to be cranial nerve number 3, the oculomotor. So that is simple on the midbrain, isn't it? The parts. And as you go up, of course, not part of the midbrain, you have got parts like the mammillary body here, and then the tuber cinereum, and then you have got on top the infundibular stalk, which will connect or hold the pituitary gland. When you look at the dorsal aspect, there are four elevations, which are known as the corpora quadrigemina. So you have got two superior colliculars, which are concerned with visual. Just think of the eyes on top, right? And then two inferior colliculars, which are concerned with auditory. The ears are a bit down, isn't it? The eyes are a bit on top. Okay, even if not so. But superior colliculars concerned with vision. So these are four. Two superior colliculi, because they're a lot, and two inferior colliculi, forming corpora quadrigemina. The nerve that is originating from the dorsal aspect of the midbrain is only one, and that's the trochlea. The trochlea nerve, cranial nerve number 4, is the only cranial nerve that originates from the back of the brain. The rest of the nerves that we've been talking about were originating from the front. Okay, you can see you have got here and here, that's the superior colliculus. One of it is colliculus. If you get the two of them superior colliculi, and then you have got two inferior colliculi. Okay, and then you have got the pineal body on top there, concerned with vision, and then you, okay, so that is basically that. And then down the inferior colliculus, you have got the trochlear nerve, which is cranial nerve number 4, that is emanating. It actually comes out here, and then it will go in front, and it comes out. You can see this is the one that is coming out from the front. That's the trochlea, but it didn't start from the front, it started from the back. Okay, so let's now do a summary of everything that we've talked about on the front aspect of the midbrain. Starting from the medulla, you have got the median sulcus, or the ventromedian sulcus, because in front you have got the decussation of the pyramids here, and then you have got the pyramids on the sides. Behind the pyramids you have got another elevation, which you call the olives, and then just behind the pyramids you have got the depression, which you call the pre-olivary sulcus, and that's where cranial nerve number 12 comes from. And then behind the olives, you have got a depression which we call the post-olivary sulcus. That's where cranial nerve number 9 on top will come from, number 10 down, and then number 11. Okay, so it's number 9, and then number 10, and then number 11, which will come much more down. And then as you go on top, you have got a junction between the medulla and the pons. So you have got cranial nerve number 6 coming from there. Cranial number 7 will be more lateral, and then number 8 even more lateral. 7 and 8 are found on the angle there, cerebropontine angle. You have got the basilar sulcus on the middle here, and then you have got the middle cerebellar peduncle. And then you can see on the pons, you have got cranial nerve number 5, the trigeminal, coming out on the lateral anterolateral aspect. Going up, you have got the midbrain. In front, you have got cranial nerve number 3 coming out from there. Posterior, you have got cranial nerve number 4 that will be coming out now from the front. And then you can see that cranial nerve number 3 originates from the anterior aspect of the crus cerebri, okay, which is also known as the basis pendaculi. Okay, so that is basically that on the anterior aspect. And of course, you can also see the mammillary body, and also the hypothalamus, the diencephalon. Basically, we're going to find the thalamus, hypothalamus, and such. And this is looking at them now on the lateral aspect. This structure that you can see here is the olives. In front, you are going to have the pyramids. You can see cranial nerve number 12 coming out from the pre-olivary sulcus, and then number 9, number 10, and number 11. You can see number 11, they come out as a lot of fibers like that, and then they'll form one. Because like the cranial nerve number 11, the accessory, I've got the spinal accessory and the cranial accessory. There's a part that comes from the brain, and then the part that will be coming from the spinal cord. That's why we hear of the spinal accessory nerve, also have the cranial. Okay, and then this is now the posterior aspect. It's also showing the choroid plexus, which is cranial, which is basically the plexus found in the fourth ventricle, which produces cerebrospinal fluid. Okay, and then you have got the superior colliculus on top, the inferior colliculus, you can see cranium nerve number 4 emanating from the back or emerging from the back and then going anteriorly. And then you can see also the fasciculus gracilis, fasciculus cuneatus more lateral, and then you have got the gracile tubercle and then the cuneate tubercle. Okay, and then you also have the structures that to make up the pons here, the triangles and the area, the vestibular area, the vagal triangle, and also the epiglossal. So that is it on the external parts of the brainstem. Next, we'll talk about the internal structures in the next tutorial.